know, here and around the world, the issue of vaccine inequity, the fact that there is not yet equal access around the world and perhaps even in our country to vaccines for COVID-19, still a burning issue. The World Health Organization, they're talking about this today. Fatima Hassan is at the Health Justice Initiative. Fatima, good afternoon to you. We keep hearing about this development, about that development, about how in the end it will be easier for poorer people here and in other parts of our continent to get access to the vaccine. Are we actually seeing any impact on the ground of these statements yet?
Thanks, Stephen. So unfortunately not. What we do know, and the data that has been released this week, is that at least 5.7 billion vaccines have already been administered in the world. The unfortunate thing is most of it has actually been in the richer parts of the world, with only 1.9% of people in low-income countries actually having received the vaccine. The figures for Africa has slightly moved upwards, and in large part because of the vaccinations in South Africa. That's now sitting at 5.6% of people in Africa who are vaccinated, compared to, for example, 50% or 60% rates that we're seeing in parts of Europe and also in North America. So there's definitely a supply issue, and there's definitely an equity issue.
We've got all of that, and at the same time we have in some countries debates around whether people get booster shots. And I'm talking about, if it's a Pfizer, for example, or an AstraZeneca vaccine, which we haven't used, people getting a third injection. These would be, in some cases, younger people, when older people in Africa haven't had their first injection.
Exactly, Stephen, and this is why, in the past week, the DG of the WHO has actually said that there should be a moratorium on all booster shots, aside from the fact about whether there's sufficient evidence to actually warrant a third shot. What they've actually asked is for both countries and vaccine manufacturers to not roll out booster shots while healthcare workers and people who are over 60, particularly in parts of Africa, have not received their first shot as yet. And, this is the reason why the TRIPS waiver is so important. This is the reason why we need to get more manufacturers into the system, and this is the reason why we need more supplies. In the last few days, COVAX, you'll remember the mechanism that is meant to provide vaccines to lower and middle income countries. And, we were told that basically they would be able to supply all of these countries with their needs, have revised their forecasts downwards by a quarter. So by the end of 2021, they're only estimating to perhaps only reach about 20% of people in low-income countries. And they've asked vaccine manufacturers to be more transparent about their deliveries and their schedules and their different agreements. And they've also asked richer nations who basically overbought or who have bought up all the supplies for booster shots to actually give up their place in the queue, so that people in low-income countries and in Africa can actually start getting vaccines and start becoming fully vaccinated.
There's so many aspects. I mean, this teaches us so many different things about the world, doesn't it? Because on the one side, you've got what politicians in the rich world say and what politicians in the rich world actually do. And we're seeing the gap between those two things. They might talk about helping poorer nations, but when it comes right down to it, actually, they're just helping their own voters.
Yeah, and again, the WHO, the DG, has said in the last few days that of the countries, particularly in the rich parts of the world, of those countries that pledge to donate billions or millions of vaccine doses to poorer parts of the world, less than 20% of those supplies have actually come through. So you're absolutely right. What we're hearing is talk of solidarity, but what we're seeing on the ground is the absence of solidarity. We don't have enough vaccines in the parts of the world where people are most affected and are most vulnerable. And this is actually now becoming the equivalent, I think, of a moral crime.
It's a moral crime. Is it going to change? I mean, are we just going to see actually this inequity continues? And I mean, this is not an inequity that results in people, going hungry for a portion of their lives. It's not an inequity that results in people maybe not having access to electricity. This is an inequity that results in people dying.
Exactly, and it's an inequity that could be repeated for the next few years, because particularly as we see in countries now repeating their vaccine programs, and whether you call it a booster shot or a third shot, basically it's a repeat of the entire vaccination program. If there aren't enough supplies for people in Africa to even get their first shot in 2022, it's very unlikely that Africa is going to come out the better through this pandemic, and the issue of travel restrictions, the issue around restrictions of movement of people, the socioeconomic impact, and most importantly, as you've correctly pointed out, the morbidity and the mortality that is associated with the lack of vaccine access is really becoming something that is going to become even more difficult for Africa to be able to counter. It's just becoming insurmountable now.
Obviously, there's also conversations around the vaccines that were produced here, and I'm talking about the fill and finish that takes place at Aspen Pharmacare. This is the Johnson & Johnson vaccine in Gqeberha. As I understand it, no more vaccine doses prepared in South Africa will leave our continent. Do you believe we can hold people to that promise?
Well, we've done a lot of work on trying to get that concession. We believe that that is an agreement that has actually materialized, but we would like to see the contracts, and we would like to see the contracts amended. And I think the Johnson & Johnson example that you point to actually is a reflection of a much bigger systemic issue around all of the contracts that vaccine manufacturers have with many governments around the world. There needs to be transparency. These contracts need to be opened and renegotiated. What the WHO is calling for is for deliveries to be diverted and for delivery schedules to be swapped, so that you can start prioritizing those countries and those regions most in need. And, you know, we simply can't take the pharmaceutical industry at its word anymore, any longer. And I think that is also, you know, one of the reasons why activists around the world are asking for all of these contracts to be transparent and to be open, so that we can see what other concessions were made and what other rights were basically undermined in this process to try and get vaccines to the richer parts of the world. You must remember the Johnson & Johnson supplies that are now being promised to only stay on the African continent hasn't really materialized. There's 220 million vaccines being owed to Africa from Johnson & Johnson via Aspen. We are still owed about 27 or 26 million on our contract. So there's clearly a supply crisis. We believe the industry cannot meet all of the supply issues. And, you know, a handful of fill and finish licenses is actually not going to cut it any longer. We need a rapid transfer of technology, a rapid scaling up of vaccines, and we need to get vaccines to as many people as possible in the world right now.
And Fatima, I mean, you would have seen the President speaking on Sunday night, worried about vaccine hesitancy, people not going to vaccination centres. How big an issue is vaccination hesitancy? How big an issue is that it may still be too difficult for some people to get to a vaccination centre, or just too expensive for transport reasons to get there? I mean, what does government do next, I suppose? And this comes amid a conversation around, you know, mandating vaccines.
Yeah, so, you know, vaccine uptake is obviously a complex issue. The data and the studies that are coming out from other parts of the world show that this is not a unique phenomenon just in South Africa. Obviously, we're dealing with the logistics of rolling out a vaccine in multiple parts of the country, and so transport and cost and safety are equal issues. The second, of course, is that there's a lot of disinformation. So you're not just dealing with vaccine hesitancy, you're also dealing with a very well-organized anti-vax movement around the world. So in some parts of the world, we're seeing vaccine uptake slowing down as a result of this. And obviously that is filtering through into parts of Africa, and particularly South Africa. But what we're also seeing is surveys showing that there's a greater willingness in lower income countries, and particularly a country like South Africa, to actually take vaccines. And so the issue which you're asking about is what should government do, is to actually leverage the fact that people do want to take vaccines. There's actually a great willingness to be wanting to be informed about the vaccines, about any potential side effects. How do you register that? How do you report those? Which vaccines sites are open on the weekends, you know, during office hours, after office hours? How do people actually get easy access to those vaccines has to become the most compelling issue for government. I mean, the issue of compulsory vaccinations or vaccine mandates is something that is now being discussed in Europe, in the US, so certainly South Africa is not the only country that is having to deal with this very complex issue of how to get more people to be vaccinated before the end of the year, so that we don't have to face such devastating wave after wave after wave.
Fatima Hassan at the Health Justice Initiative, really do appreciate